This is a complicated area. It's complicated for me, and I've been to so many sessions. I've seen so many slide sets. I've heard so many talks. I've been to several places where they make biologics and biosimilars. It is complicated, and I'm beginning to understand it. It's taken a year, but I'm starting to get it. It's a lot, it's a moving target, and I keep up on it. I keep reading it. In the latest or last week's Economist, there was a story about biologics and biosimilars, and there are issues that are brought up about that. Things that say, well, what are the issues we're facing today? Well, patients are going to be looking for information too. And the information patients are going to be looking for are going to be, what's the difference in the treatment schedule? For example, if I'm getting Remicade at a dose, 7.5 milligrams per kilogram, but the biosimilar isn't approved at that dose, what happens to me? Can I get that? That is up to a few different steps, and we don't know who's going to make those decisions or on what basis. They're going to wonder about, what am I dealing with now? Is my insurer changing me? What's happening with my insurer? I can feel people's angst already about this. That's why so many people are listening today. I don't have an easy answer. I have enough challenges dealing with insurers myself. If an insurer is listening, please write in and reassure me that everything is going to be okay. And what about healthcare providers? I don't think anything's going to change there. You may have to change pharmacies. That could happen, but I don't know, and I don't see why. I would hope not. I would hate to lose a pharmacy that's helping you tremendously. I don't see why you'd ever have to change your doctor because of this. We're all trying to work in this environment and protect patients. If we see something that doesn't make sense, we do try and tell the insurers about it, and we also can share that with manufacturers and Health Canada. What about disease education? Those things will still go on, and I hope in enhanced ways. That would be nice to believe in. There's widespread networks across Canada that exist already. New ones will be coming out. The new ones will learn from the mistakes that were made with the old ones, but the old ones took a long time to build and a long time to get it right. And to have the right expert who answers the phone and answers your questions, my nurse's questions, pharmacist's questions, that wasn't easy. We'll see what the growing pains are. We don't know yet. Long-term expertise, it just isn't there. We don't have long-term expertise with these kinds of biosimilars, the ones that are these large antibodies. It's something very new to almost all of us. And some of the experiences that some groups have had have made them nervous. So we're going to try and pay attention and learn as much as we can. I'll leave this up a bit. There's a few links that you could look at if you're interested. Some of these are patient groups, some are other societies, some are patient groups based on disease, a whole bunch. The idea is that we will have this up on the web, we hope, and available for downloading, and I'll leave that to the organizers to make happen. It would be nice, I think, to see under each of these what information they can provide, but I think there's a lot out there, and it's quite readable. It shouldn't be confusing, but it is like studying for an exam. You'll read one and think you understand it, and then you'll read a second and think, that's different than the other one, I'm confused. Welcome to the club. I'm hoping I can remove some of that confusion today. The patients' associations do have positions, though, on biosimilars. There's a lot of consistency there, and consistency with what I've spoken. I've read their comments, and I've read the reviews, and I've heard them speak about their concerns. They talk about having naming right up at the top. They want a safe process. And that process isn't just the process of making the biosimilar. It isn't just the process really of getting everything right in making it, which is what Health Canada sees. It's the process of getting it to you. How do we make sure that that gets to you in a way so it's always the same and it's always going to work for you? And if there's any issues, weather, distance, mail strikes, whatever, you get the drug that you need. We need to make sure that those things are in order, and those things do take time to build. We, as healthcare providers, myself as a physician and specialist, will have to learn more. For general internal medicine and family medicine, they hardly ever use biosimilars like this. They never use them. They almost never use biologics. And if that's the case, what's going to happen to their sense of security if your family doctor doesn't really know exactly what you're taking or whether it matters? A lot of education of healthcare providers is going to have to come, and it's going to be enhanced from what we've already done already. It's been a long, and I think very thoughtful, and for me, a very rewarding process to see even internal medicine specialists start to understand some of these issues and understand how it might play out and what they have to be looking for. Cost comes up as an issue, of course, and that was one of the reasons for making generic drugs. Try to bring down cost. In a way, by having patent limitations, it also should drive innovation. But this is not necessarily that type of innovation. This is an innovation in copying. So an innovation in copying could be important if it brings down the prices. We do know that when looking at the retail prices, there does seem to be a discount. How that will impact all of the facilities and everything that patients and healthcare providers need, we don't know. I keep saying we don't know, and I mean it. We really don't know. What do we think is going to happen? It's a marketplace. I suspect, and I hope I'm even saying it here, that prices will level out. There may not be a difference. All of that is negotiations between manufacturers and the providers who are the insurers, and the provincial health providers who pay for drugs. All of them have to be involved and decide how are they going to manage this and what kind of price or other benefits are they going to be looking for. What is their financial risk management strategy? All of these are being done across the country as we speak. It's something happening now, and it's something that's going to be evolving over the next year. Physicians also have their position on these, whether we wear a stethoscope or a white coat or not. I do neither. What do we think? Well, these quotes are very familiar to me. These are what we say at meetings. Costs must not override safety and efficacy, and they should be regarded as standalone products, biosimilars, not as just substitutes and taking one off the shelf and then saying, nah, I think I'll take the other one. It doesn't work like that. And we're saying that clinicians have to really learn a lot and know about the indications. And if there is no evidence in your indication, but it's been approved, what's happening with that biosimilar? What's the data? What is it in a year? What is it after 1,000 or 2,000 patients have been treated? We need to know this. I hope that information will be collected and reasonably distributed to healthcare providers, to Health Canada, and to anybody else who cares about it. Biotech Canada is a group that works with the public and with industry and with physicians and specialists to try and understand what's going on in the biotech industry. They actually have come out with, I think, a very thoughtful summary of a large meeting. It was a meeting that I mentioned before that contained all the specialists from the areas that are involved, as diverse as dermatology and cancers in children. And the idea there was to really get a lot of input from the specialty groups, from the specialists, and from healthcare providers generally about how is this going to play out? What are our concerns? And I have to say, and I'm putting myself out, this is from my heart, we heard a lot of mechanical things. What about the structure? What about the process? What about glycosylation and understanding what that means? Some of it was very technical. Some of it was very specific to process issues. I had one word. My word was trust. Who do I trust in this? And that's where I sort of fell short. I fell short a little bit thinking, what do I trust? And I have to say for me, and I'm not a big stickler about this, but I trust the data. I want to see the information. Let us all see the information and share our interpretation about it and know what's going on. To me, it is about trust. So some final thoughts before we open it up to your questions. You have questions? Ask your doctor. Is your doctor going to know a lot about biosimilars? Probably not. So what do? Use the patient support groups. Use the advice of what you find online. Biotech Canada is not a bad source for that. I think if you have concerns, you want to raise them. If you think we don't really know, then say so. You deserve to get the best answers you can. And the best answer isn't always a perfect answer or a completely informed answer. It might just be as good as it gets. And if you do want to speak up, I know patient support groups would like to hear from you. I know groups like the Canadian Skin Patient Alliance love hearing from patients. They want to have patients talking to payers about all the issues. They want to have patients talking to governments about how they're funding. They want to look at report cards across the country and make sure that when it comes to biosimilars, that all the payers get an A+, that they're all making smart decisions based on the data. They're getting an A+ because they're getting the answers right. The final decision on which biologic you receive should be yours. It should be yours to make. And at the end of the day, you probably should not be having a conversation where somebody says, oh, but it's saving us money, or you won't reach your cap as quickly. That should not be part of the conversation. That's up to the manufacturers and the insurance agents to talk sense. And it's up to the governments to make sure that it's safe and that things like switches aren't happening. And then if anything does happen, we know the right name so that we can get the right answers to protect you and other people in the future. Remember, the final decision on which one you receive, it's your choice. Thank you very much.